Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today, once again, I want to talk about a drug issue. This time, perhaps more benign because it concerns over the counter drugs, but still somewhat distressing because an FDA advisory panel recently recommended that the ingredient phenylephrine, which is in products like Tylenol, Mucinex, and Benadryl, and promoted as a decongestant, doesn't really work. And again, it's just disappointing that we would be putting something into our bodies over decades when apparently going back to like 1993, there were those within the FDA saying this ingredient isn't effective and so it should be pulled. I guess the good news is no one is believing that this will do you any harm. So I guess no need to start throwing things out. But it does suggest that we might all be more aware of when this is in a product and whether there are alternatives. According to what I've read, this is an advisory panel, and so they don't have the final say, but you know what? They voted unanimously to recommend that companies remove this ingredient from these products. And it's just disappointing that they wouldn't have done that on their own if the science is that conclusive. But, it's another good example of the conflict between Big Pharma and the rest of us. We love Big Pharma when they're saving our lives with COVID vaccines and so on. And then we're disappointed when we find out something like this, where the science at this point seems pretty clear, but I suppose it would have been inconvenient to go ahead and remove this ingredient prior to it being mandated. So that seems to be what those in the know think will happen. So anyway, just wanted to make sure people were aware of that. And I thank you for listening. Take good care. Bye-bye.